Hey everybody, thanks for joining me for today's literature review entitled The Impact of Radiation on Lymphedema, a Review of the Literature. I actually found this literature review while I was looking for a particular study on radiation for breast cancer patients, but I thought this would be a great one to educate the public on, both patients and caregivers and medical professionals alike, because it talks about the impact that radiation has on both breast cancer patients and those with gynecological cancers. And it just is really straightforward and easy to read. So this literature review starts by reminding everyone the importance of radiation therapy in cancer treatment. Radiation is an integral component of the treatment process in that it extends disease-free survival, and it also helps to reduce local or regional recurrence of disease. So it is still very, very commonly used. There are many different types of radiation therapy that are utilized in cancer treatments, and there are also many side effects that can happen as a result of radiation treatment. So some of the risks that are commonly seen are impaired mobility, nerve injury, skin burns and skin changes, leading to skin as well as underlying tissue fibrosis. For those of you who aren't familiar with the term fibrosis, that means normal tissue is replaced by connective tissue and eventually leads to long-term scarring down of that tissue, decreased mobility, and a lot of problems can come from scarring down of tissue. Other side effects are many, but the very largest side effect that is found is lymphedema. So it is actually one of the most common side effects that are seen as a result of radiation treatment of any kind across the board. So this literature review specifically looks at radiation as a result for breast cancer patients, as well as patients with gynecologic cancers. So this review goes on to talk about what lymphedema is, a reminder of how the lymphatic system as a whole works and how it functions, and what happens when radiation impacts the lymphatic system. There are many problems that are seen, but it goes on to state that damage to the lymphatic vessels occurs in a delayed fashion after radiation, as the surrounding tissues develop into dense, fibrous tissue that compresses and blocks lymph flow. So the most important word here for me is delayed. For those of you who know about radiation therapy or who have gone through radiation therapy, you may see some immediate side effects, such as the skin changes or burns, some, nerve pains, pins and needles, some decreased mobility. But lymphatic changes happen over a very long period of time. Fibrotic changes don't happen over days or weeks. It usually happens over weeks to months to even years. So that scarring of the tissue, that fibrotic process, is a very long process that occurs, and lymphedema can happen many years later. So that's really, really important to know and to understand. It also prevents collateral vessels or alternate pathways, as well as new healthy lymphatic vessels to form because of those fibrotic long-term changes. Lack of those compensatory pathways leads to lymphedema potentially. It also goes on to state that lymph nodes themselves are very highly radiosensitive, meaning that their ability to filter lymphatic fluid is very affected as the lymph node goes from a healthy node and eventually undergoes fatty tissue changes and ultimately fibrosis of the node itself, meaning it is unable to filter that fluid. And the more lymph nodes that are removed, the higher the risk of lymphedema following radiation. So these tissue changes, in combination with normal post-surgical inflammation that occurs with any surgical removal of a tumor or of lymph nodes, significantly promotes the production of lymphedema. And this persistent swelling of lymphatic fluid can lead to fibrosis and further increased inflammation as it is an ideal medium for cellulitis and lymphangitis, so inflammation and problems of the lymph vessels themselves. So you can see why this is such an important message and literature review to understand. So now it goes a little bit more specifically into upper versus lower extremity lymphedema, so I'm going to discuss that now. When we're talking about breast irradiation, how does that affect upper limb lymphedema? So this review states that post-mastectomy radiation therapy increases the risk of lymphedema by 5 times. And furthermore, when radiation therapy is coupled with lymph node dissection, this risk increases to nearly 10 times, with further increases seen with more lymph nodes removed. So the risk increases from 9% to 40%. This is very, very significant if you are a breast cancer patient who needs to undergo radiation therapy, to know your risks. Make sure you understand your risks. Make sure you see a certified lymphedema therapist and you're looking for small changes over time. I added that last part. It's not part of the literature review. It does go on to state that the specific type of radiation is going to be important to understand as well, whereas external beam radiation therapy has a higher rate of lymphedema versus other types of radiation. And volume and distribution of axillary tissue irradiated are also independent risk factors for developing lymphedema. I don't think it's worth getting into those small details for these purposes, but what I do feel like is important as a patient, please make sure you understand what type of radiation you are going to get, exactly where the radiation is going to be targeted. Is it targeted to the breast as well as the lymph nodes in the armpit? Will there be lymph nodes above the collarbone involved? What part of the axillary lymph nodes will be radiated? It is divided into separate sections, and certain sections will have a higher rate of lymphedema than others. So make sure you understand these risks and ask these questions of your radiation oncology team. So now I'm going to talk a little bit about the lower limb lymphedema, and it is stated here that radiation therapy has also been found to increase the risk of lower limb lymphedema in patients with gynecological cancers such as ovarian, vulvar, and endometrial cancers. Lower limb lymphedema follows dysfunction in the pelvic and inguinal lymph nodes. So the lymph nodes directly in our groin area, as well as a little bit further up the chain where they start to come together from the lower legs deep in our abdomen and in our abdominal cavity. Post-operative radiation therapy in this region increases lymphedema risk by up to 40%. External beam radiation therapy is again associated with an increased risk of lymphedema compared to vaginal brachytherapy, where the radiation is delivered directly from inside the vaginal cavity. So again, knowing the type of radiation that you're going to have, the exact location, and other important pieces of information will help you better understand what risk you may have of lymphedema following your interventions. This goes on to say further that diagnosis of lymphedema is actually rather difficult, and what they consider the best ways for diagnosis. And it also goes on to say that there are certain limitations with this study. Only journals published in the English language were included. There is possible interpretation bias from some of this, but I think the numbers speak for themselves. When you're talking about the importance of all potential treatments for cancers, radiation is always going to be part of that conversation, but please make sure you understand your risks and understand what possibilities there are at the completion of treatment and long after the completion of treatment. I hope you've enjoyed this literature review. Please let me know if you have any questions. I'll be happy to answer them. The review is, of course, posted below, and I look forward to your comments.